The tibial stab incision is made halfway between Gerdy's tubercle and the center of the fibular head. The femoral stab incision is made slightly proximal and posterior to the lateral epicondyle. The antero-lateral ligament will run obliquely to the antero-lateral tibia. Drill a 2.4 pin 8 mm proximal and 4.3 mm posterior to the lateral femoral condyle. Aim slightly proximal and anterior to avoid ACL tunnel convergence. After the pin is drilled, split the iliotibial band around it to facilitate the introduction of the swivel lock. Drill a second 2.4 mm guide pin 22 mm posterior to Gerdy's tubercle and 10 mm distal to the joint line. This should be the approximate midpoint between Gerdy's tubercle and the center of the fibular head. Isometry can be tested by wrapping a piece of fiber wire around the pins and moving the leg through the range of motion. When the knee moves from extension to flexion, the fiber wire should be isometric or become slightly shorter by no more than 5 mm as it moves to 90 degrees of flexion. If it becomes shorter by more than 5 mm, adjust the femoral pin. Overdrill the femoral guide pin with a 4.5 mm cannulated drill to a depth of 20 mm. Load the whip-stitched sutures of the gracilis graft through the peak eyelet of the 4.75 mm swivel lock anchor. Insert the swivel lock into the drilled hole. Ensure the eyelet is fully seated so that the threads of the swivel lock anchor have started to touch the bone. Hold the paddle of the swivel lock and turn the knob to insert the anchor. The swivel lock sutures can be removed. Overdrill the tibia guide pin with a 7 mm cannulated drill to a depth of 20 mm. Use a hemostat to dissect underneath the iliotibial band to create a plane from the femoral incision to the tibial incision. Place a passing suture from distal to proximal with the hemostat. Use the passing suture to pass the graft to the tibial side. Whip stitch approximately 20 mm of graft that will be placed in the tibia. Place the 7 mm forked tendonesis swivel lock anchor over the graft. Push the forked end into the tunnel and adjust tension by pulling on the graft. It is important not to over-constrain the antero-lateral ligament. Fix the anchor with the knee in extension and neutral rotation. Once the anchor is in place, the sutures can be removed. Cut the end of the graft exiting the tibial socket.